Now, this is a CDM. I need someone to read this case for us, please. I need a volunteer. CDM. Please,
Doctor, can I
Facebook.
read?
Yes,
Okay.
please. Yes, please. Yes, please.
Okay.
Please read.
A 16-year-old girl presents with concerns about irregular menstrual cycles, moderate to severe acne, and increased facial hair growth. Her BMI is 29 and physical examination reveals acanthosis nigricans. Lab results confirm elevated level of serum testosterone and an LH ratio greater than 2:1. A pelvic ultrasound shows the presence of multiple ovarian cysts. The patient is diagnosed with polycystic ovarian syndrome. Question: you are discussing the management of options with the patient. From the list below, select the two best initial treatment options to manage her PCOS symptoms and prevent long-term complications.
Okay, please look at the way the
Option.
question has been put very well. Okay. Doctor, please go on and read the answers for us.
Okay. Options. Option A, spironolactone. B, metformin. C, finasteride. D, lifestyle modification and weight loss. E, combined oral contraceptive pill. F, clomiphene citrate. G, levothyroxine. H, GnRH agonist. I, elopharentine cream. J, oral arsortretinoin. K, metroxyprogesterone acetate. L, progesterone only pill. M, legrolite. N, dexamethasone. O, laser hair removal. P, vitamin D supplementation. Q, bariatric surgery. R, insulin therapy. S, metronidazole cream. And T is pioglitazone.
You see, that's how the CDMs are, right? By the time you realize, you go like, oh my goodness, what did I do?
Yeah,
What just happened to me? And now you have to choose two, right?
2.
Select
Yes.
the two best. And remember the rule in CDM. There
Okay.
may be 3, 4 correct answers. I'm just saying, or you may choose 3 or 4 correct answers. But a person says 2. If you even choose 3 and all 3 are correct, you still get 0. Okay, so now, doctors, please, what are your answers? That's the problem with CDM. A lot of, so let me see the combinations. Some are going for A and B. That's Dr. Tara. Some are going for D and E. Looks like D and E are a lot. Dr. Mandina, Dr. Lydia, Dr. Rashmi, Dr. Amandip, all are going for D and E. Now, Dr. Raphael went for B and D, okay? And iPad went for D and E. Dr. Tutua went for D and E. Gideon went for D and E. Okay, so it looks like D and E is reigning. Oh, and Dr. Obia went for B and E. Now, the question is saying something very interesting. It says, from the list below, select the two best initial treatment options to manage her PCOS symptoms and prevent long-term complications. So now the first question you should ask yourself is, what are the long-term complications of PCOS and how do I prevent them? So the answer will be D and E. What are the long-term complications? Who can remind me? And then we will see whether our answer makes sense. What are the long-term complications?
Doctor, it was
Hypertension,
high blood
sleep
pressure,
apnea,
Metabolic
diabetes,
syndrome.
Metabolic syndrome,
obesity,
hypertension,
sleep
obesity, diabetes.
apnea,
Exactly.
cardiovascular. Yes.
Exactly. And endometrial cancer, right?
Yes.
So,
Endometrial cancer too.
what
Yes.
is the reason? Lifestyle modification and weight loss. Lifestyle modification, including dietary changes and exercise, is a foundational aspect of managing PCOS, right? Because we want to we want to keep their weight in shape, especially in patients who are overweight or obese. Weight loss can help improve insulin sensitivity, reduce androgen levels, and regulate menstrual cycles, thereby addressing the root cause of PCOS. Now, why is DE also correct? Combined oral contraceptive pills. The combined oral contraceptive pills is a first-line pharmacologic treatment for managing menstrual irregularities and hyperandrogenism. It helps to regulate menstrual cycles, reduce androgen levels, and alleviate symptoms such as hirsutism and acne. And we also learned that one of the complications, long-term complications, is endometrial cancer, right? Combined oral contraceptive pills helps, to regulate the cycle and also to prevent that. Why are the rest wrong? Spironolactone. So we are using, look, this is very deep. So let's take our time. Why are the various options wrong? I'm not going to run through them. We're going to take our time to learn this very well. Spironolactone is an anti-androgen used to treat hirsutism, but it is typically added as an adjunct to oral contraceptive therapy rather than being the first-line treatment. All right? So that is why spironolactone, in as much as we use it for the management of some parts of PCOS, is not your first answer. Metformin is beneficial for PCOS patients with insulin resistance or glucose intolerance, but is not a first-line treatment for menstrual irregularities and hyperandrogenism without significant metabolic derailments. So, yes, the fact that you've diagnosed somebody with PCOS doesn't mean next line you should start metformin. You start metformin when the patient is found to have metabolic syndrome. Doctors, please, are you following me? Let me continue. Finasteride. Finasteride is an anti-androgen that can be used to treat hirsutism, but is less commonly used compared to spironolactone and is not a first-line treatment. Clomiphene citrate. When we use clomiphene citrate, is used for ovulation induction when the patient wants to be pregnant. Right? And clomiphene citrate is not to prevent any long-term complications. It is because the patient has fertility wishes. Doctors, please, are you getting the whole point now? We are building. Levothyroxine is used to treat hypothyroidism and is not relevant in the management of PCOS at all. Okay? And GnRH agonists are typically used in the treatment of endometriosis, not PCOS. Right? So I go on. Eflornithine cream is topical treatment for hirsutism, but does not address the underlying concern of PCOS. And oral isotretinoin is used for severe acne, but as well, it does not address the underlying issue of, it's like, you have a tree which has been planted with a place which has poison, right? And all you are doing is plucking off the fruits and not dealing with the soil. So if you give oral isotretinoin, that's what you are doing. You are just managing the acne. You are not dealing with the root cause of the problem. Doctors, please, are we all on the same page? Beautiful. And then medroxy progesterone acetate is used for short-term management of irregular bleeding, but is not a comprehensive treatment for PCOS. So just take your time and look at the reasons why each of the wrong answers are wrong. Progesterone-only pill, while this can help with menstrual irregularity, it does not address hyperandrogenism and is less effective than combined oral contraceptive pills. By the way, when will you start somebody on progesterone-only pill in the context of PCOS? What is the indication for progesterone-only pill in a patient with PCOS? You do that when the patient has clotting concerns, like a patient who has had a previous history of DVT, and you know that you need to give something to regulate their menstrual cycle, but you know that the patient has had a clotting disorder, and so you don't want to give combined oral contraceptive pills. That is when you go for progesterone-only pill. Doctors, are we on the same page? Awesome.
Yes.
Dr. Shah says yes. Okay, what about liraglutide? Liraglutide is a GLP-1 agonist used for weight loss in obesity, but is not a first-line treatment for PCOS. Okay, what about dexamethasone? Dexamethasone is used for adrenal hyperplasia and is not appropriate for PCOS with no other indications or without other indications. What about laser hair removal? It's like the fruit thing. You are taking off the fruit, meanwhile, the tree is in a place with poison, right? What about vitamin D? Are we going to use vitamin D in the management of PCOS? Vitamin D is not a first-line treatment for PCOS. What about bariatric surgery? It is considered for extreme obesity, but is not an initial treatment. And those in MedCognito, you realize that if you go to abnormal weight, that particular objective, under non-specific symptoms, we've talked about indications for bariatric surgery. We've talked about all those things, what a patient who has had bariatric surgery should do. Please, when we are done, go back to your portal and go and review that. And then insulin therapy. Why are you giving insulin therapy when you've not even diagnosed the patient as having diabetes? You've not even tried metformin, glycoside, Jardiance, you've not tried Ozempic, you've not tried all these things, and then you're jumping straight to insulin. Okay, and metronidazole cream, it is an antibiotic and is not relevant to the treatment of PCOS. And pioglitazone, it is a thiazolidone dione used for type 2 diabetes management. not the first line, for polycystic ovarian syndrome.